Hello everyone, welcome back to LIFEHUE YouTube channel. This is the 7th video of our complete general medicine series. In our previous video, we completed with cardiovascular system and this video is about respiratory system. In this video, we will cover pneumonia, COPD, pulmonary tuberculosis and bronchial asthma. So what is pneumonia? Pneumonia is defined as the infection of lung parenchyma and interstitium of the lung. Pneumonia is more common at extreme of age and in winter months. The risk factor for developing pneumonia are smoking, alcohol use, immunocompromised state, diabetes mellitus, congestive heart failure, COPD, and malignancies. Pneumonia is broadly divided into two types, community-acquired pneumonia and nosocomial pneumonia. Nosocomial pneumonia consists of two entities, hospital-acquired pneumonia, which is the pneumonia developed after 48 hours after hospital admission, or ventilator-associated pneumonia, which is pneumonia diagnosed 48 hours or more after endotracheal intubation and ventilator support. The most common route of infection is microaspiration of oropharyngeal secretions colonized with pathogenic microorganisms. Pathologically, pneumonia is classified into four types. Lobar pneumonia. This type is typically seen in pneumococcal pneumonia. Generally, entire lobe of the lung is involved. Second is bronchopneumonia. This type is common seen in HCAP. There is neutrophilic exudate in bronchi and bronchioles with peripheral spread of infection to the alveoli. Then comes interstitial pneumonia and biliary pneumonia. These are respiratory signs in lobar pneumonia. On inspection and palpation, we find tachypnea, decreased movement of chest on the side of the disease, no shift of tracheal or apex feet, no mediastinal shift, increased vocal fragments. On percussion, we find impaired or dull note. On auscultation, we find bronchial breath sound, whispering, pectoriloquy, increased vocal resonance, cacophony, crackles, crypts, and pleural rub. Complications of pneumonia may be pulmonary or extrapulmonary. Pulmonary complications are parapneumonic, pleural effusion, emphysema, suppurative pneumonia, lung abscess, acute respiratory distress syndrome, pneumothorax, SORS pneumonia, and extrapulmonary are hepatic, pericarditis, meningoencephalitis, multi-organ failure, ectopic abscess formation. Investigations include radiological investigations, sputum and pulmonary secretion examination, blood test, which includes blood culture, ABG analysis, and total and differential leukocyte count, and serological test to detect the antibodies, and other tests like PCR and specialized culture test. Before the treatment of pneumonia, its severity is assessed using CORP 65 criteria, in which C stands for confusion, U stands for blood urea nitrogen more than 20 mg per deciliter, R stands for respiratory rate more than 30 per minute, B stands for blood pressure systolic less than 90 mmHg or diastolic less than 60 mmHg. 65 stands for age more than 65 years. The Krupp 65 criteria are helpful in deciding whether the patient should be treated on outpatient basis or hospitalized. Patients with 2 or more criteria need hospitalization. In supportive therapy, oxygen therapy is there. Intravenous fluids may also be required in hospitalized patients. Antibiotic therapy is started in outpatients and also hospitalized patients. Next disease is COPD. It is chronic obstructive pulmonary disease. It is a common preventable treatable disease which is characterized by persistent respiratory symptoms and airflow limitation that is due to airway or alveolar abnormalities, usually caused by significant exposure to noxious particles of gases, and also influenced by host factors including abnormal lung development. It includes chronic bronchitis and emphysema. Chronic bronchitis is defined as a condition which is history of cough and sputum on most days for at least 3 consecutive months for more than 2 successive years. Emphysema is defined as irreversible destruction and enlargement of air spaces distal to terminal bronchitis. Pure form of these two conditions are rare in the majority of cases that coexist. Etiological factors include cigarette smoking, biomass fuel smoke exposure, which is very common in India, air pollution, infections, post-tubercular COPD. Other factors are occupational exposure. Severe alpha-1 antitrypsin deficiency is a proven genetic risk factor for the development of emphysema. Clinical features include general features and respiratory features. General features are cyanosis, sign of right heart failure like edema, raised JVP, hepatomegaly, ascites, sign of CO2 retention such as flapping, tremor, mounting, pulse, obtundation, pursed lip breathing, wasting and weight loss, and respiratory features such as use of accessory muscles of respiration, indrawing of intercostal muscles during inspiration, increased diameter of the chest, loss of cardiac dullness and liver dullness, diminished vesicular breath sound, prolonged expiratory phase, generalized wheeze, crackles mostly at the bases. Investigation includes pulmonary function test, diffuse study, chest X-ray, arterial blood gas analysis, serum alpha-1 trypsin, and polycythemia. Treatment of stable COPD includes smoking cessation, oxygen therapy, bronchodilators, corticosteroids, combination therapy, antibiotics, phosphodiesters, mucolytic and antioxidants, pulmonary rehabilitation, vaccinations, and surgery. Acute exacerbations includes hospitalization, oxygen therapy, antibiotics, bronchodilators, oral corticosteroids, mechanical ventilatory support. Now come pulmonary tuberculosis. It is divided into two parts: primary pulmonary tuberculosis and post-primary pulmonary tuberculosis, which is adult type. If you want a detailed video on tuberculosis, please comment below. Here we are discussing about investigations and management of tuberculosis. So in investigations, we have demonstration of AFP, culture method, molecular methods, interferon gamma release assays, radiological test, tuberculin skin test, histopathological test. In the treatment of tuberculosis, a program known as DOTS is initiated by India. The anti-tubercular drugs used are rifampicin, isoniazid, pyrazinamide, ethambutol, and streptomycin. Next diseases, bronchial asthma. It is chronic inflammation and increased responsiveness of lungs. Reversible air obstruction happens. Pathophysiology includes early onset and late onset. Pathological changes are bronchial smooth muscle hypertrophy and hyperplasia, hyperplasia of mucous glands, mucosal edema with infiltration of granulocyte, hyperplasia of mucosal and submucosal vessels, thickening of basement membrane, infiltration with eosinophilic lymphocyte, mast cells, neutrophils. Clinical features include episodic asthma, chronic and persistent asthma, or acute severe asthma. Investigations include pulmonary function tests including spirometry, peak flow meter, bronchial provocation test, chest X-ray, arterial blood gas analysis, and allergic test. Management includes avoidance of factors, drug therapy, which include controller medication and reliever medications. So this is the end of our video. In our next video, we will discuss about the hematology topics, anemia, bleeding and clotting disorders, leukemia and lymphoma. If you want a detailed video on any topic, please comment down below. And if you have watched the video till here, don't forget to subscribe to the channel, like, share and comment the video. Thank you so much for watching till here.